Alright, so this is my video going over the compartments of the lower extremities. Basically, I'm going to start with the lateral compartments, then the anterior, posterior, then the medial, talking about nerve supply, blood supply, insertion points, and kind of what everything does. So just starting with the lateral, which there's only two muscles, and they are responsible for ankle eversion. So the one I currently have highlighted is the fibularis longus, or the peroneus longus. This inserts onto the medial aspect of the calcaneus, and it originates from the fibula. So basically just give you a front view from the front, lateral side, fibularis longus, and then if we just follow it down, you can see that it kind of turns into a tendon, and then travels medially to the superior fibular reticulum and inserts into the medial aspect of the calcaneus. So here we have the calcaneus, and you can see this insertion point right here. The next one I want to talk about is the fibularis brevis, and in case just looking at the names, brevis is brief, and so it's much shorter than the longest. The longest originates all the way from the top of the fibula, and brevis inserts, I'm going to take away longest here in a second, but it inserts, like midway down the fibula, so much shorter, and it inserts into the fifth metatarsal digit of the foot. So the next thing I want to talk about with the lateral compartment is it's innervated by the superficial peroneal nerve. Now, this one's pretty easy to follow actually. I'm just going to go up to kind of around the popliteal fossa, so up here, and I'm going to remove this, biceps femoris. So we're looking basically at the popliteal fossa, which is a bit of a mess right now, but basically we have the sciatic nerve, and as you guys know, it splits into the tibial nerve, which I'll discuss later, and the common fibular nerve. So the common fibular nerve travels down and crosses anteriorly to the fibula. So here's the fibular nerve, the fibula. I'm just rotating to have a lateral look. It crosses anteriorly and deep to the fibularis longus, one of the lateral, one of the muscles of the lateral compartment I've been talking about, and it innervates it along the way with the superficial peroneal artery or nerve, which I'll show you here in a sec. So just removing this so we can get a better look at that. Basically we have the common fibular nerve passing anteriorly, and it sends the deep fibular nerve, which innervates the anterior compartment. It sends it deep to the extensor digitorum longus of the foot, and then it sends the superficial fibular nerve to innervate the fibularis longus and fibularis brevis of the lateral compartment, which, just to repeat, are ankle everters. And so you can see that the superficial fibular nerve lies superficial and basically the whole way down the extensor digitorum longus. And I'm not going to, but if I did put back in the fibularis longus, you would see that once you get more inferior, it'll be found just anterior to the fibularis longus. And then the last thing I want to talk about was the blood supply of the lateral everters, which is just the fibular or peroneal artery. Once again, if we come back up here, we can see we have the popliteal artery, which then splits into the fibular artery, which travels laterally, and the posterior and anterior tibial artery, which I will show later when I kind of removing more layers of muscle. But this guy, the fibular artery or the peroneal artery, is what supplies the lateral compartment, which are the everters. Now, the next thing I wanted to talk about was the anterior compartment, which are the extensors, just with a few exceptions of stuff that, or like the tibialis anterior, but they're extensors. So starting with the, sorry, just lagging a bit, with the tibialis anterior, it originates from the lateral condyle of the tibia, so just highlighting the tibia, lateral, medial. Here's the tibialis anterior, and attaches to the medial cuneiform, and in order to get there it needs to pass underneath the reticula, both of them, the superior and inferior. And I think this is really well shown on this model, so just zooming in a bit. Once again, the tibialis anterior, which is an extensor, as well as a dorsiflexor, and as you can see, it passes underneath the superior extensor and the inferior extensor in order to insert on the medial cuneiform, which it's kind of hard for me to show here without removing muscles. I want to show you later, but I guess just trust me on that one. And just to repeat, it also dorsiflexes. Now, the next one I wanted to talk about, just zooming out here and moving superiorly. The next one I want to talk about was the extensor digitorum longus of the foot. Now, this originates from the fibula head and attaches to all the long toes. Like the tibialis anterior, it needs to pass underneath both of these guys in order to reach its destination. I think it's really well highlighted here, actually, traveling from the lateral condyle, from the fibula and the lateral condyle, and going underneath these guys, and you can see it individually sending out tendons to then attach to the phalanges. And so I suppose it would be quite obvious that this then is an extensor of the phalanges. If you contract this muscle, the toes are going to move kind of upwards, so to speak. And then one, I guess, important caveat to this muscle is it has an offshoot known as the peroneus or fibularis tertius, which arises from its lateral aspect and inserts at the base of the fifth metatarsal, allowing for inversion. So here it is. As you can see, it arises from the lateral aspect and is attaching at the fifth metatarsal. And I think I got that wrong, sorry. It allows for eversion. And then the last muscle I want to talk about, which is medial to the digitorum longus and lateral to tibialis anterior, is the extensor hallucis longus. So this guy attaches to the big toe and is an extensor of it. And same with the other two, has to pass underneath these guys, sends out a tendon, attaches to the phalanges of the hallux or the big toe. Now, the nerve supply of the anterior compartment is the deep peroneal nerve. So that's why I started with the lateral, is that I could get rid of the fibularis longus and reveal the deep peroneal nerve. So just to reiterate, because repetition makes it easier, you basically have the common fibular nerve or common peroneal nerve, and then it splits traveling underneath the fibularis longus and traveling across the neck of the femur, or the fibula, sorry. It splits into the deep fibular nerve and the superficial fibular nerve. The deep fibular nerve innervates the whole anterior compartment. Pretty easy. Just to kind of show you that, I'm just going to take this guy away, and that, voila, you can see that it basically travels down the whole aspect of the leg and innervates the shooting out branches here, innervates the whole anterior compartment. The last thing I wanted to show you in regards to the anterior compartment is the blood supply. You have the anterior tibial nerve, which is your blood supply. So coming back around here to the area of the popliteal fossa, we have the superficial femoral artery, also just known as the femoral artery. Turns into the popliteal artery as it passes through the abductor hiatus of the adductor magnus, which then branches into the posterior tibial artery, which supplies is some of the supply for the posterior muscles, as well as the fibular artery, which supplies the lateral muscles. And then we can see the anterior, we can't see it actually because it's passing through this direction. Wonder if I'll be able to find that for us. Nope. here it is. Sorry about that. So here's the anterior, branching off right here, and traveling across the fibula, and coming down and moving along the interosseous membrane. And it actually needs to travel through the interosseous membrane in order to get to the anterior compartment of the leg. And we're actually asked to identify that in the dissector, so I guess that's relevant. And this provides blood to the whole anterior compartment. And as said before, it's a branch of the popliteal artery. Okay, so I think I'm going to take a bit of a break before going on to the posterior compartment, as well as I'm going to cover the dorsum of the foot very quickly. So, see you at the next video.